Hey guys, it's been a while. I'm currently 32 weeks pregnant and I haven't updated this in, I'd say, like a month. It's been quite the whirlwind this past month. As you can tell, I've cut off quite a lot of my hair. And it's already grown back a few inches since I've recorded a video for you guys. Last time I was talking, I was just getting over the flu and I was wondering if I had Intrahepatic Cholestasis of Pregnancy, also known as obstetrical cholestasis or cholestasis of pregnancy, and sometimes just called cholestasis. And what it basically means is that the liver doesn't do its job, things slow down, bile acid levels tend to rise in the blood, amongst other things that are rising in the blood that we don't necessarily test for. So the main signs and symptoms of ICP, Intrahepatic Cholestasis of Pregnancy, include incessant itching that is typically worse at night, especially on the hands and the feet, which I had, and it was just awful. It kept me awake all night. The only thing that really helped relieve it was using ice packs on my feet. Everything else was just more of a distraction than actually helpful. Other signs and symptoms include dark urine, pale stools, sometimes, not often, there's jaundice of the skin, and generalized fatigue, malaise, which I had almost all of the symptoms except for jaundice. I didn't have any jaundice, which is a rare symptom anyway. So clinically, I was diagnosed based on my symptoms, and they did take my bile acid levels. It took almost 2 weeks to get the results back, and I did have elevated bile acid levels, so I was diagnosed based on lab values as well. So I do have Intrahepatic Cholestasis of Pregnancy. And what that means is that now I have to go in for twice weekly non-stress tests to make sure that the baby's doing all right in that moment of time. It doesn't really provide me much of a peace of mind, because I know that non-stress tests just tell you what's happening at that exact moment in time. So it's kind of like a false sense of hope. So I rely mostly on baby movements, and he or she has been totally active and fine. I also had an ultrasound to make sure that he or she was growing well enough, and they were. So that gave me more relief than anything. I started a medication called Urso, or ursodiol, which helps reduce the level of bile acids in the blood. My doctor, who I got referred to from my midwife, doesn't think that Urso is linked with better outcomes from the baby, for the baby, but my research tells me otherwise. Now, after I started it, my levels went back down to 2.5, and the cutoff is between like 1 and 10. So I don't have clinical cholestasis at this moment in time, but I'm going to continue taking the Urso just in case, because my acid levels can rise without warning. Itchiness is not linked directly with the amount of bile acids in your blood, so don't be fooled by that. I'm going to have to post a whole video on intrahepatic cholestasis because it's such an interesting thing, and it's so rare, or it's just not diagnosed enough. And I think that we should really get the word out about it. I feel like there's not enough information out there. It's apparent that a lot of medical professionals that I've spoken with so far have no idea how to actually treat it and how to actually diagnose it, and that's kind of scary, because one of the risks that comes with ICP is an increased risk of stillbirth, especially if the pregnancy goes beyond 37 or 38 weeks. With that said, I will be induced at 37 weeks. I am a very natural, crunchy, hippie birthing person, so this just freaks me out, but I know that it's instinctually, medically, research-wise, it's best for baby that they come out at 37 weeks. After the flu, I had a sinus infection, ear infection, turned into a double ear infection. This ear is still draining occasionally after a course of antibiotics. I had a root canal done. The weekend after the flu came, we had a second hit of a lot of snow, like a lot. I could not get my car anywhere. Our streets were not plowed for an entire week. There was no way I was getting anywhere. So I spent that weekend in just absolute pain. And as a pregnant person, I can take Tylenol. It didn't do anything. Apparently, my tooth infection, one that I had a cavity filled on less than a year ago, got from my tooth to my bone, to my sinuses, to my ear. You can imagine how much pain that was causing me. A lot. But I finally went in for a partial root canal, so it's like a temporary fix. I have to go back in pretty soon to get the rest of it out. And it is definitely infected in there. Whoo, boy. So they fixed that and they sent me home with nothing. No antibiotics, no pain medication, nothing. So that same night, I was in 8 to 9 out of 10 pain, and it was 2 hours straight of that, no breaks in between. So I had to go to the ER. I've never been to the ER for pain before, so I felt so weird. I'm like, oh, it's probably not that bad. There I am sitting crying, and then I stood up and I'm like, I see spots. Can somebody take my blood pressure, please? So they took my blood pressure and it was like 156/96, which is ridiculously high. So I was obviously in a lot of pain. My baseline, and like the next day, my blood pressure was down to 106/73, which is like my norm. I am rambling. It's been so long. I almost forgot to show the belly. So with my belly, I am 32 weeks along. Baby's growing fine. Belly's quite a lot bigger than last time I showed you guys. There are no stretch marks yet on my stomach, but I have noticed some on my hips and my bum. It's getting harder and harder to move around in bed. Baby's quite active and flips between being breech and being in a head down position. And he or she will probably continue to do that right up until delivery, since this is not my first pregnancy. And I hope he's not breech. He or she's not breech, because apparently we don't do breech deliveries on the island where I live, which is very silly because I am a prime candidate for a breech delivery and I have no fear in my ability to deliver them that way. I think I'll be holding my breath until the baby is outside of me and breathing and healthy. With this condition, it's kind of a little bit scary, but I've kind of come to terms with it over the past month. I think that's all I'm going to share for now. I'm well enough to start doing videos again. I'm not going to promise anything, just in case, but I would like to get back into a routine before the baby comes at the end of March. So, comment, like, subscribe, tell me what you've been up to because I've missed you guys, and I'll see you next time.